Why is your red meat video offline? Victoria, thanks for asking. A lot of people have been speculating about this actually. The reason I had to take the video down is because there was some confusion between the sponsor and myself about what they were comfortable with having within the video as far as content goes. And they wanted me to change something once I posted the video. Me being a person who stands behind my medical ethics and didn't want to change my medical opinion, we came to a mutual agreement that we just take the video down. What I want to say about the red meat video is that I still very much stand behind everything I said. You should dramatically reduce, if not remove entirely, processed meats. And if you have them once in a while, that's not a major risk that you should be really worrying about. Yes, overeating red meats is probably not ideal, but eating them in moderation alongside vegetables, and especially preparing them in the right way, like I said, marinating them, not overcooking them, probably reduces a lot of these negative effects we've seen in some of the research. And if you choose not to eat meat because of ethical reasons, more power to you. That's your decision. But it doesn't mean that you have to come at and yell at other people who don't necessarily see eye to eye with you. Whenever I make a video, sponsored or not, I want to give you my true, honest opinion. I take that trust you give me very seriously. I will never tell you what someone else wants me to tell you unless I stand behind it. Now that being said, I will work with all sorts of sponsors as long as they're letting me say my message that I would say if the video wasn't sponsored. Stop just doing dumbbell curls. You need to work out the rest of your body, thanks. Jonathan, I actually don't do dumbbell curls at all. I'm a firm believer in doing compound lifts. In reality, the way that these guns come about, I'm just kidding. Pull-ups, weighted pull-ups, I do rows. Those are the ways I get my bicep workout in. I don't think you necessarily need to do, nor is it tremendously effective to isolate the bicep and just do curls. Chrissy poo. I want to know if this is normal or not. When I get sick, my skin gets painful to the touch. Normal. The reason it's happening is probably because you have a fever. And when you have a fever, your skin becomes hypersensitive. So anything touching it will feel like a weird, gross feeling. And this probably evolved as some sort of survival mechanism. Totally normal, nothing to worry about. As long as it's only present while you're sick. Leafa, what's your thought on breast reduction? I mean, it depends why you're getting breast reduction. I have a lot of patients who have very large breasts, and because of that, they develop serious back problems because they're carrying so much weight. Also, it can affect the way that you see yourself as a person, so it can hurt you mentally. I agree that everyone is beautiful, but I also think it's unfair to say everyone should just be totally happy with their bodies as is. If someone has a bad scar and they're feeling self-conscious about it, lying about it and just saying that it's beautiful, trying to convince them otherwise, a little bit unfair. Some things make people feel self-conscious. So it's about getting an honest history, a true physical, figuring out what the risks and benefits are of each procedure, and making an individual decision for yourself with your doctor. Rashika Lav Toshinuri Yagi. Is it normal for your lower rib to pop? No, I'm not even really sure how your lower rib would pop. The lower ribs are called false ribs because they're actually not attached to your sternal. They're just sort of floating in your back side. Maybe they're rubbing against each other. Maybe there's a tendon or ligament that's getting caught there. But if it's causing you discomfort, please go see your doctor because you really should find out what that is. I've noticed when I get extra tired, I snore a lot and then I wake up with a sore throat. Should I see a doctor about sleep apnea? Lindsay, you should absolutely see your doctor about sleep apnea because while sleep apnea isn't an immediate threat, it's one of these conditions that causes chronic hazard to your health. So you develop other medical problems like high blood pressure, chronic heart disease. If you can control your sleep apnea early on, the less of these other diseases and complications you're gonna develop later. My thing as a family doctor is about preventing problems before they become one. And that's something you could totally do if you truly have sleep apnea. It sounds like you have sleep apnea, especially if you're snoring to the point of getting a sore throat. Dana Habib. Hey doc, so I'm about to graduate from high school and my dream is to work at either the ED or be a paramedic. But everyone is saying that it's too traumatizing. Is that true? Dana, I don't want anyone to dissuade you from entering a particular field you're passionate about. Because in this life, passion is hard to find at times, and especially in a field that is incredibly rewarding, in a field that's incredibly needed in our society, I don't think you should let anyone dissuade you. What I think you should do is you should go volunteer. You should go on a ride along if you can. You should talk to folks who actually work those jobs. Once you expose yourself to the field, you can have a better idea if you truly love it or not. It's very easy to fall in love with the idea of something, but once you actually start doing it, you may not feel the same way. So I always say first-hand experience trumps what anyone else is telling you. So if you're passionate, you want to try it, go try it and then make your decision. Hey Mike, can you get stretch marks from losing weight too fast? Love your channel. Yeah, actually what can happen is anytime you have a rapid change in weight, you can get unusual marks on your skin. I've had patients that have had bariatric surgery, lost a lot of weight. Not only do they get stretch marks on their skin, but they just have a lot of loose skin and end up needing plastic surgery afterwards to get rid of that skin. Now that being said, you should still moisturize your skin. That does help. Don't splurge on the $100, $200 creams that promise you removal of stretch marks. Stretch marks, when you grow rapidly in size and then shrink, actually come from a tearing or scarring of the skin. No cream is really gonna fix that. Hurricane Devin, hey Dr. Mike, so I recently got braces on my teeth and my mouth is really sore and tender. Is there a way to help me lower the pain quickly so I can chew harder foods again? I feel you. You know why? Because I've had braces twice. First, when I was in high school, I got Invisalign, and every 2 weeks you had to get a new plate put in and it would shift your teeth and it would be the most painful, excruciating. Once I got older, my teeth shifted a little bit. I had to get braces a second time and I had to get real braces. Like I had a metal mouth while in medical school, and it was a difficult moment because I wanted to look my best, but I also knew I was investing in my future. A simple trick that I used that worked well for me is there's some numbing agents that work if you have like a sore in your mouth. Those can work well sometimes, but in reality, the only solution is time. And I know it's horrible every time getting your braces tightened, and it comes with a huge amount of pain. So first step, understand that this pain is not a threat to you. That alone can lower the level of some of the pain. But then there are some numbing agents that you can go and buy over the counter in the pharmacy. Obviously talk to your dentist first, but that could be a great way of treating the first day pain that you get when you get your braces tightened. Question, tips for someone with bad posture. Tat, this is actually pretty funny because a lot of people in my curbside consult video and my resident reaction video where I toured the set with Manish Dayal, people told me I had poor posture. I sometimes have poor posture when I'm interviewing people, mostly because I'm 6'3" and most people are not 6'3", so I try and get on people's level, and that does hurt my posture somewhat. But if you work with a physical therapist and retrain your muscles, you can actually improve your posture. Is there any way to induce your period? This is an interesting question, Jasmine. I don't know how old you are, and I don't know if you've ever had your period before. I'll give you sort of the medical background on this. Primary amenorrhea is someone, a girl who has never had her period. Secondary amenorrhea is a secondary cause, meaning that you've had your period before, but now something is influencing your body to not have a period. So I'm not sure what's causing you to want to have your period. Is it because you missed it and you want it? It's irregular and you want to make it regular? But this is a really good time for you to go see your doctor, have a conversation about what it is you really want, because it's really hard to give you a simple answer when there's so many things that could be going on, both from a health perspective, but also in your mind, why you want to induce your period. So to answer your question, can you induce a period? Technically, yes. It depends for what purposes. It depends on what stage of your life. Go see your doctor, have a conversation, and figure out what works best for you. What do the other doctors at your work think of your YouTube? Christopher, we don't talk about it much. The senior doctors that I've worked with in the last 5 years, they always ask what I'm up to. They love hearing the successes that I'm having because they know how passionate I am and how hard I work. Because I know you only see what's happening on YouTube or on social media, but behind the scenes, it takes a lot of work to make this happen. Not only does it take a lot of work to make this happen, I never let my work in the hospital or my patients suffer because I'm busy here. They're a priority. I love being a doctor and being one-on-one in a room with a patient, so I make sure all my work is done there prior to doing anything with social media. So they respect me, they appreciate it, they love that I'm battling misinformation, and hopefully, if this podcast that we've talked about in the past ever comes to fruition, maybe I can get them to guest on the show. Drop your questions and comments down below. As always, stay happy and healthy.